Hi again, this is part 2 of our lecture series on joints and kinematics of the vertebral column. In our last lecture, we introduced you to some parts of individual vertebra and we looked at how vertebrae join together. So now we want to take that one step further and look at when those vertebrae are joined together, both just to adjacent vertebrae, but to the vertebral column as a whole, how do they move? So the three joints that join adjacent vertebrae together and form the basic motion segment as part of a whole vertebral column are the two zygoapophyseal joints or Z joints and the joint between the two bodies of the vertebra by the intervertebral disc, sometimes called the interbody joint. The axis around which movement occurs is always right in the center of the intervertebral disc. This particular schematic is showing flexion of the lumbar vertebra and showing the axis in the middle of the intervertebral disc that would relate to that. But if you're talking about rotation or you're talking about lateral flexion, the axis is still centered around the middle of the intervertebral disc. When determining what movement is possible between two particular vertebrae, there's three key things to consider. The first is the joint space. That is, what space is available between the two vertebral bodies and what space is available in between the two facets that are forming the zygoapophyseal joints. The second one is soft tissue structures surrounding the joint. So in this scenario, you can see the supraspinous and interspinous ligaments are ligaments that are going to resist the flexion that's occurring. But we'll come back to some specific examples of that. And the third one, which we've alluded to in quite a bit of detail in our last lecture, is the orientation of the Z facet joints. So depending on the orientation, that's going to have a strong guidance on what type of movements allowed at those joints and in what plane that movement can occur. It's important to note here that we're talking about movement just at a particular motion segment here, so just between two adjacent vertebrae. But what we really want to look at functionally is movement over the whole vertebral column. And this is described as cumulative movement. That is, flexion of the entire vertebral column is an accumulation of small degrees of movement all the way up and down the vertebral column. We're now going to move on to talk about some connective tissue structures around these motion segments. But just before we leave this slide, there's two that are very visible that I'd like to point out. The supraspinous ligament you can see running between the tips of the spinous processes. And the interspinous ligament you can see running between the body of the spinous processes. They both have excellent orientation for limiting flexion, and they can also get compressed somewhat in the end ranges of extension if we're going into hyperextension through the spine. This is a mid-sagittal view of our vertebral column that shows some of the ligamentous structures that provide structural support for it, but that also limit movements as those motion segments are trying to move around each other. Posteriorly, you can see two of the ligaments we pointed out on the last slide, the supraspinous ligament and the interspinous ligaments around those spinous processes. If we move to the anterior side of this diagram, you can see the anterior longitudinal ligament running down the anterior surfaces of the vertebral bodies, but also blending with the intervertebral disc that it's running past. This means that not only does it limit extension of the vertebral column, it reinforces the anterior parts of those intervertebral discs. If I move to the back of the vertebral bodies, you can see the posterior longitudinal ligament running down their surfaces, and similar to the anterior longitudinal ligament, this time it's reinforcing the posterior parts of those intervertebral discs that it's running past. Because the posterior longitudinal ligament is behind the axis for flexion and extension, it's going to tighten in flexion, the same as our supraspinous and interspinous ligaments. The last ligament I'd like to point out is ligamentum flavum, which I'm indicating now running from the lamina of one vertebra to the lamina of another vertebra. Being behind the axis of rotation for flexion and extension, it's going to tighten an extension. The other thing that it does practically is it creates a flexible foramen for that spinal nerve to emerge from the vertebral canal. It's made up of a high degree of elastin fibers, and when you look at this in a cadaver, it has a yellowish tinge to it because of those elastin fibers. We believe that it's evolved to become highly elastic so that as we're going through lots of ranges of movement through the vertebral column, it's elastic enough not to impinge the spinal nerve as the shape of that intervertebral foramen changes during movement. The other structure well shown on this diagram is the intervertebral disc, which I'm indicating now. So the two parts of the intervertebral disc I'd like you to know are the nucleus pulposus in the center of the disc and the annulus fibrosus around the edge of the disc. As a whole, the intervertebral disc is known as a symphysis, joining the two vertebral bodies together. And a symphysis joint is a fibrocartilaginous joint. The nucleus pulposus is made up of a gel-like substance which has excellent force absorption and dispersion properties. We'll deal with this in a sec. The annulus fibrosus is concentric rings of collagenous tissue. Quite often, lots of type 1 collagen tissue that's very strong. This slide shows an anterior and slightly oblique view of some of the structures we've just looked at. The one I'd particularly like to point out is the intertransverse ligament, running between transverse process and transverse process, as this can't be seen on the previous diagram. You can imagine that this ligament is going to tighten as the motion segments of vertebra go into lateral flexion. Let's look more closely at the important function of the intervertebral disc. It accepts the majority of the vertical load through the vertebral column, ranging from 60 to 80% down in the lumbar region. This is important as it unloads or de-stresses the Z joints and frees them up to guide the movements between the vertebrae. It does this through its structure of a nucleus pulposus in the center and the annulus fibrosus around it. The gel-like substance of the nucleus pulposus is made up of very well hydrated proteoglycans. Between 70 and 90% of the nucleus pulposus is water. This decreases slightly as we age. It also decreases throughout the day, which is one of the reasons that intervertebral discs slightly shorten during the day and make our vertical stature slightly shorter. The nucleus pulposus is able to absorb high vertical loads and then dissipate them outwards towards the annulus fibrosus. You can see this well depicted on the right-hand side, where it's dissipating force laterally, superior and inferiorly, and radially out to the annulus fibrosus. You can see then why it's important for the annulus fibrosus to be composed of strong type 1 collagen concentric rings of fibrous tissue, so that as those loads are dissipated towards it, it's able to hold together as a structure. The disc is well guarded against regular cyclic compressions that we would see during normal everyday activities, provided those compressions are relatively evenly distributed across the disc. If we get repeated uneven compressions to the disc, it can cause damage to the annulus fibrosus, and this can then cause the nucleus pulposus to leak out through the fibrotic material and out into spaces that it's not supposed to be. The disc will respond well to cyclic compressions that it will see throughout normal everyday activities, provided those compressions are relatively even, as you can see in this diagram. On the far right, you can start to see compressions that are becoming uneven on the disc, that are creating compression forces on one side and tension forces on the other. If this is repeated chronically, then this is when we start to see tears of the annulus fibrosus and herniations of the nucleus pulposus through the disc and out into spaces where they can create impingements of spinal nerves or onto the actual spinal cord itself. We've looked at ligamentous structures in the vertebral column previously. As we move towards the cervical column and then into the head, they take some unique forms. The ligament you can see on the right-hand side here, and in a real person on the top left, is the ligamentum nuchae or nuchal ligament. This is a continuation of the supraspinous and to a degree the interspinous ligament, up past the cervical spinous processes and then up onto the back of the skull. On the skull, it attaches to a couple of features I've pointed out on the bottom left picture, the external occipital protuberance and along the median nuchal line, sometimes also called the external occipital crest. The weight of the head on the atlas has a natural tendency to tip forward into flexion, and the nuchal ligament has a key role in providing some passive tension in extension to counteract that. In the previous lecture, we looked at the atlas and axis as individual bones. We now want to put those two bones together, look at the way they interact through their joints, and also look at some of the cervical ligaments around them that help to give them structure. Let's first look at the picture on the bottom right. This shows the atlas and axis articulating together so that you can see the dens of the axis coming up through the atlas and sitting against the facet. The green arc on this picture now indicates the rotational movement that will be allowed between the atlas and axis due to this articulation. In the cervical spine, rotation at the atlas and axial joint accounts for about 50% of total cervical rotation. So it's a critical joint in the cervical spine, the whole vertebral column, and the body. The green arc also indicates some ligaments which are named in the top two diagrams. That is the transverse fibers of the cruciform ligament of the dens. This ligament prevents the dens from sliding posteriorly into the vertebral canal, potentially impinging the spinal cord at the C1, C2 level, and as you can imagine, that can be significant to a fatal injury. The top two pictures show that cruciate ligament of the dens also has some vertical fibers that run up to the occipital bone and further reinforce that atlantoaxial articulation around the dens to make sure that it's very stable. If you look at the top left-hand picture, where you can see that cruciate ligament of the dens, the transverse fibers, and the vertical fibers, what you can also see are the alar ligaments, which run from the dens at about a 45-degree angle, also out towards the occipital bone. Essentially, the left alar ligament will tighten as you look to the right-hand side, and the right alar ligament will tighten as you twist or rotate your head to the left. On the top right-hand picture, they have cut away those vertical fibers of the cruciform ligament, and what that allows you to see is it exposes where there's another ligament that runs from the tip of the dens straight up to the occipital bone, called the apical ligament. Again, this is just to reinforce and hold on to the dens so that it doesn't have any tendency to slide around in relation to the atlas. And finally, there's some membranes of the atlantoaxial joints that run from the atlas or axis or both and up onto the base of the skull that you can see the first of on the left-hand side. You can see the tectorial membrane that's been labelled there, which is a continuation of the posterior longitudinal ligament of the vertebral column. The left picture on this slide is showing a mid-sagittal view of some of the structures we were just having a look at. So the first one I'll point out is the tectorial membrane, which again is that continuation of the posterior longitudinal ligament. So similar to the posterior longitudinal ligament, it will tighten as the vertebrae move into flexion. This picture also shows the apical ligament, which we identified before, running from the tip of the dens up to the base of the skull to provide stability for the den. And on the right-hand diagram, you can see those alar ligaments, which we described before, running from the dens obliquely up towards the occipital bone. And there again on the right-hand side. The left-hand diagram shows two new ligaments. It shows a continuation of the ligamentum flavum, which turns into the posterior atlanto-occipital membrane. You can see as the ligamentum flavum is passing up past the laminae of these vertebrae, it then continues on to the base of the occipital bone. And on the anterior side of this diagram, you can see the anterior atlanto-occipital membrane, which also is a continuation of a ligament, in this case, the anterior longitudinal ligament, running up the anterior surfaces of the vertebral bodies and then continuing up onto the base of the skull. Now that you're familiar with the vertebra, how they fit together through joints, the different variations we see across regions, and the ligaments that support them and also resist some movement, we can get into the details of the kinematics through these different regions. What the top left diagram shows is that the axis of rotation for rotation itself, lateral flexion, or flexion and extension all pass through the middle of the intervertebral disc. Also remember that the intervertebral disc joint between the two vertebral bodies is taking the greatest proportion of the vertical load through the vertebral column. And remember, what this is doing is freeing up our zygopopliteal joints, or Z joints, to guide the movement that's occurring between adjacent vertebrae, and then that movement adds up cumulatively across the whole vertebral column. At the bottom left, I've written down for you the 3 ways that zygopopliteal joints guide that movement. So one of the things they can do is to move closer together and use the joint space within that joint, that is to approximate. They can also use the joint space in that joint to move further apart or separate. And lastly, they can use that joint, the 2 facet surfaces, to slide against each other, depending on what orientation they're in. There is a small degree of pivot movement that those 2 facet joints can do against each other. And I'll point that out as we go through. In the top right, you can see some examples of the differences in orientation of facet joints. And we've already gone through some of these briefly in the previous lecture. We're going to go through the differences in facet joint orientation in each region in detail. This slide shows 2 things. On the left-hand side, it makes the point about cumulative movement. So you can see that for us to rotate to the right 90 to 95 degrees, the lumbar vertebrae at the top are contributing about 5 degrees in total, the thoracic vertebra then 35 degrees, and our cervical vertebra about 50 degrees. So it's an accumulation of movement all the way up and down the vertebral column to be able to achieve that functional movement. The picture on the right gives you an example of facet joint orientation in the lumbar vertebra. So it shows that looking superiorly, the facet joints in the lumbar vertebra are largely orientated vertically. This means that they have limited ability to be able to rotate against each other. We can approximate those joints, or the space in them, a little bit, and there's a little bit of axial pivot that we can do once those joints touch, but essentially the lumbar vertebra can really only rotate about 1 to 2 degrees against each other, and about 5 to 7 degrees in total across the whole lumbar region. The bottom 2 pictures of that diagram show what happens if we try to force movement through facet joints after they've reached the limit of their movement. So on the bottom left, you can see a potential injury that can occur with lumbar facet joints where they can fracture if we try and rotate them too far. At the far right of that diagram down the bottom, what it shows is that even if the facet joint doesn't fracture itself, it can create an angular tear at the annulus fibrosus because it's creating torsion forces through that intervertebral disc that it's not structurally set up to do. Now, if you get an annular tear in the annular fibrosis, that can result in nucleus pulposus leaking or a herniated or prolapsed disc, as we discussed a few slides ago. This slide quantifies the point I was making about cumulative movement. I'm not going to go through it in great detail because we're going to step through each of these regions as we go. But what you can see is if you look at the left-hand side of this diagram with flexion and extension, each region of the vertebral column contributes towards flexion and extension movements. And you can see depending on the varying morphologies, even within those regions, they're going to contribute different amounts. And we're going to step through that region by region.